Welcome to this video on extrapyramidal symptoms, essential knowledge for mastering psychiatry for nursing exams. Let's start with a question. Which of the following is the most common cause of extrapyramidal symptoms, or EPS? The correct answer is B, typical antipsychotics. They block D2 receptors in the basal ganglia, leading to EPS. Atypical agents have a lower risk. Next question, a patient on haloperidol suddenly develops neck muscle spasms, or torticollis. What is this? The answer is B, acute dystonia. It presents as sustained, painful muscle contractions, typically in the neck or eyes, occurring within hours to days off initiation. Moving on, the feeling of inner restlessness and the inability to sit still is known as what? The answer is A, akathisia. It is characterized by intense, subjective restlessness, often causing patients to pace or constantly shift weight between their feet. Drug-induced Parkinsonism includes all of the following except which one? The answer is D, choroform movements. Parkinsonism includes tremor, rigidity, and bradykinesia. Choroform movements are characteristic of tardive dyskinesia. Next question, which EPS is characterized by lip smacking, tongue protrusion, and facial grimacing? The correct answer is C. Tardive dyskinesia is a late-onset, often irreversible condition involving repetitive, involuntary orofacial movements. What is the drug of choice for the treatment of acute dystonic reaction? The answer is C. Anticholinergics like benztropine or trihexyphenidyl are the first-line treatment for acute dystonic reactions. Final question for this segment. Akathisia is best managed by which class of medication? The answer is A. Propranolol, a beta blocker, is the preferred treatment for akathisia that does not respond to a dose reduction of the offending antipsychotic. Let's continue our review. Which condition involves high fever, autonomic instability, and lead pipe rigidity? The answer is B. Neuroleptic malignant syndrome, or NMS, is a life-threatening medical emergency characterized by hyperthermia, rigidity, and autonomic instability. Which of the following antipsychotics has the lowest risk of EPS? Answer C, clozapine, is an atypical antipsychotic with a very low propensity for causing EPS, though it carries a risk of a granulocytosis. What is the oculogyric crisis? The answer is A. An oculogyric crisis is a dystonic reaction where the eyes are locked in an upward gaze. Tardive dyskinesia is most likely associated with. The answer is B. Tardive dyskinesia is a chronic, late-onset side effect occurring after months or years of antipsychotic exposure. Cogwheel rigidity is a hallmark sign of which EPS? The correct choice is A. Cogwheel rigidity, a jerky movement when limbs are moved passively, is a classic symptom of drug-induced Parkinsonism. The antidote used for NMS in severe cases is. Answer A is correct. Dantrolene, a muscle relaxant, and bromocriptine, a dopamine agonist, are key treatments for NMS. Which EPS appears within 4 to 96 hours of initiation? The answer is B. Acute dystonia has the fastest onset, typically occurring within a few days of starting the medication. Finally, which neurotransmitter imbalance causes EPS? Answer B. EPS is caused by dopamine blockade, leading to a functional deficiency of dopamine relative to acetylcholine in the nigrostriatal pathway. What is the most effective nursing intervention for a patient with akathisia? The correct answer is B. The nursing priority is to report the side effect for dose reduction or adding medication, such as beta blockers. Tardive dyskinesia is often triggered by what factor? Answer B is correct. Chronic blockade leads to dopamine receptor supersensitivity, which is the hypothesized cause of tardive dyskinesia. Which of these is a risk factor for developing EPS? The answer is D. Risk factors are multifactorial, including gender, age, and high dosages of antipsychotics. Which screening scale is used for tardive dyskinesia? Answer B is correct. The AIIMS Abnormal Involuntary Movement Scale is the gold standard for monitoring TD. Anticholinergics can worsen which symptom? The answer is C. Anticholinergics may exacerbate the symptoms of tardive dyskinesia, which is not a classic symptom of neuroleptic malignant syndrome, NMS. The answer is C. NMS involves rigidity or stiffness, not flaccid paralysis. Pill-rolling tremor is a classic sign of which EPS? Answer B is correct. Pill-rolling tremor is a characteristic Parkinsonian symptom.